Good afternoon, ladies and gentlemen, the chairpersons. I must thank Dr. Nanda, Dr. Chopra, Dr. Rakesh, and Dr. Parashar for inviting me to come here and to give me the chance to present a paper. In the next few minutes, I'll be talking about the new modality of the treatment of the end-stage coronary artery disease as well as the heart failure, the extracorporeal shockwave therapy. The management of the end-stage coronary artery disease is often hopeless because of lack of evidence-based, uniformly effective, safe and inexpensive treatment options. Gene or stem cell-based therapies are not yet ready for routine clinical use. Heart transplantation is seriously limited by the scarcity of the organs. In this regard, extracorporeal shockwave therapy is emerging as a non-invasive means to treat refractory angina and heart failure. First of all, what are the acoustic waves in the medicine? There are the ultrasound waves, there are the extracorporeal shock waves, and there are pressure waves. Shock waves are three-dimensional acoustic waves characterized by high amplitude and abrupt peaking of 35 to 120 megapascals that propagates rapidly through a medium. They arise from sharp and violent disturbances generated from a lightning stroke, bomb blast, or other form of intense explosion. It is like the throwing a stone into the pond and there is a ripples of waves, and the shock waves is like that. There is a source of sound and there is a shock waves, and then there is a burst of waves around it. A plane flying faster than the speed of sound and creating shock waves. We know the sonic boom. Shock waves produced by an extracorporeal shock wave machine are identical, only on a smaller scale. This is the principles how the shock waves are produced and how these shock waves are delivered to the ischemic area of the myocardium. Extracorporeal shock wave therapy produces high energy shock waves and delivers them to the tissue via the surface of the skin, and it is generated by an electric storage capacitor with variable high voltage, which is charged and subsequently rapidly discharged by electroacoustic transducers. It is almost like the echocardiographic machine, where the ultrasound is used for the diagnostic purposes. This is one of the animation produced by the company who is propagating the extracorporeal machine. They claim that it is also a part of the revascularization therapy. Besides the surgical, interventional, this is one mode of the revascularization, and it may produce the cardiac angiogenesis. No anesthesia is required. It is, as it is non-invasive, and it is depends on the echo for the myocardial dysfunctional area. I think we can go on in the next slide. So already there are uses of the shock waves in the medical science, the breakdown of the renal stones, the extracorporeal shock wave lithotripsy, the disintegration of the gallstones, the orthopedic applications are there, plantar fasciitis, epicondylitis, calcanean span non-union, etc. And these are the high energy shock waves, about 90 megapascals, and the low energy shock waves, that is nearly 1/10 the energy of the urological applications, that is about 10 megapascals are for the cardiovascular conditions. So these are the not new use of the shock waves, rather the new applications of the shock waves, and the potential uses are also explored, the refractory skin ulcers, erectile dysfunctions, and the chronic pelvic pain syndrome. These the mechanisms, the two basic effects. One is the cavitation effect, the micrometer sized violent collapse of the bubbles inside and outside the cells, and another is the shear stress on the cell membrane. And both these result in the upregulation of the endothelial nitric oxide synthesis, vascular endothelial growth factor, its receptors, and also proliferating cell antigen. Also recruitment of the bone marrow derived endothelial progenitor cells, leading to the new vascularizations. New vascularization improves the myocardial perfusion, and the result of which is increased stroke volume and cardiac output. So the shock wave exerts a mechanical pressure and tension force on the afflicted tissue, and this has been shown to create an increase in the cell membrane permeability, thereby increasing microscopic circulation to the tissues and the metabolism within the treated tissues. And the same things we have described it, but there is currently no standardized guidelines for the use of the shock waves in the cardiovascular conditions. It has been applied to patients symptomatic on minimal activities, CCS class 3 or 4, in spite of receiving maximally tolerated medical therapy with no possibility for PCI or CABG on a recent angiogram. So there are some studies in the animals, in the pigs, and most of the studies are done by the Japanese peoples, and these are the published in the as back as the 2004 and 6. In the also the use of the epicardial shockwave therapy improves the ventricular function. This is also an animal study. And this is the human study, 24 patients with ischemic heart failure and LV ejection fraction less than 40% received the extracorporeal shockwave therapy in addition to the regular treatment, and there is a significant increase in the left ventricular ejection fraction. There is a clinical improvement as well as the improvement of the echocardiographic. But there is no definite role in the acute myocardial infarction, though there are uses in the animal model, and there is also place in the peripheral arterial disease. The advantages of the cardiac shockwave therapy is that it is a non-invasive and it is safe without any known procedural complications or adverse effects. It can be done repeatedly even as outpatient procedure. Also no surgery or anesthesia is required. But the limitations are that the passage of the shock waves to their target can result in the damage to the tissues, though it is unlikely because it is the low energy shock waves in cases of the cardiac application, may result in the localized bleeding and damage to the lung parenchyma. Cardiac arrhythmia is another possibility, and complications are not observed with low energy shock waves used in the cardiovascular arm. It is most of the complications are recorded in the use of the high energy in the breakdown of the gallstones and the renal stones. The current status of the cardiac shockwave therapy is that no formal recommendation is available for cardiac disorders by the prestigious regulatory authorities around the world, including FDA of the USA, the Medicines and Healthcare Product Regulatory Agency of UK, European Medicines Agency of European Union and Therapeutic Goods Administration of the Australia. But the thing is that they don't even says any negative comments on this therapy. They don't include in their guideline, but they don't say that it is harmful or it is useless. So standard treatment guideline on coronary artery disease and heart failure have not yet addressed. At present, a number of the clinical trials are going on to determine the efficacy as well as the safety of the cardiac shockwave therapy in refractory angina and advanced heart failure. However, these studies are relatively small. Indications of the extracorporeal cardiac shockwave therapy are rapidly expanding and can probably be used as a hybrid procedure in combination with existing revascularization studies. However, its efficacy and safety should be ascertained by larger, multicentric, placebo-controlled clinical trials. The indication and contraindication should more precisely be defined. Standard guidelines for the treatment of coronary artery disease and heart failure should address this newer modality before routine applications. Otherwise, chances of the inappropriate and potentially harmful use remains. Take home message is that the extracorporeal cardiac shockwave therapy is a newer, non-invasive treatment modality. It is of very shockwaves are sound waves of very high amplitude and short duration. Low energy shockwaves are suitable for cardiovascular applications. Present indications include refractory angina and heart failure, where PCN and CVG are not indicated. Principal therapeutic benefit appears to derive from the angiogenesis. Uniform indication, contraindication and treatment protocol are yet to be developed, not yet approved by the regulatory authorities, but the future applications, potential future applications are there. Thank you very much for the patient hearing.
Thank you, Dr. Majumder. Very straightforward.